All right, let's talk about drawing blood. To most people, it seems pretty routine, right? But you and I know it's so much more than that. The precision of a phlebotomist, that's the critical first step in diagnostics, and getting it right means everything for patient care. So let's break down the most common mistakes that can happen and, more importantly, the techniques to master that perfect draw every single time.
Okay, so let me ask you a question. When you think of a mistake in phlebotomy, what's the first thing that pops into your head? A shaky hand, maybe? A missed vein? Using the wrong tube? Yeah, those are all significant, for sure. But the most critical error, the one with the most severe consequences, it's something else entirely.
Believe it or not, the biggest mistake happens before you even think about uncapping the needle. It isn't a technical error with the stick itself. It's a failure in the most basic, foundational steps. And that's exactly where we're going to start.
So that brings us to phase 1, before the stick. This is all about patient interaction and preparation. And let me tell you, mastering these steps is absolutely 100% non-negotiable.
And here it is, the big one. Improper patient identification. This is one of the most serious and yet most preventable mistakes in all of healthcare. Rushing is your enemy here. The gold standard, the best practice, is the 2 identifier rule. You must actively confirm the patient's full name and their date of birth, and you have to cross-check it against their records or their ID band. No shortcuts.
This quote really captures the stakes, doesn't it? Just think about that for a second. If you misidentify a patient, every single thing that happens after that point is wrong. It's a catastrophic domino effect. The lab results go to the wrong chart, which leads to a wrong diagnosis and a wrong treatment. It all starts with one simple skipped step.
Now, beyond just identification, communication is your most important tool. Introduce yourself. Walk your patient through what you're about to do. Give them a chance to ask questions. You know, a nervous patient can be a risk for complications. Your job isn't just to draw blood. It's to make sure they're safe and as comfortable as they can be. So keep an eye on them for any signs of distress. That proactive observation is the mark of a real pro.
All right, we've got a solid foundation. Patient ID is confirmed, communication's clear, now we're ready for the technical part. Welcome to phase 2, the draw itself. Here, we're focusing on the equipment and the technique.
Let's start with just one number, 60. 60 seconds. That is the absolute maximum amount of time a tourniquet should be on a patient's arm. Not a second longer. Why? Because going over that limit fundamentally changes the blood you're collecting.
The term for this is hemoconcentration. Basically, leaving the tourniquet on too long squeezes the watery part of the blood out of the vein. This artificially concentrates everything else that's left behind. So what does that mean? It leads to falsely elevated results, which creates a diagnostic picture that just isn't real. That's why it is so critical to release that tourniquet as soon as you see blood flow.
Now let's talk about the little details that add up to a perfect draw. First, always aim for the median cubital vein if you can. It's your most reliable target. Next, use a 23-gauge needle or larger to avoid damaging the red blood cells. We'll touch on why that's so important in a minute. And finally, the mechanics. Bevel up and enter the skin at a smooth 15 to 30 degree angle. This is where practice really makes perfect. This next point is a core principle of professional phlebotomy. It is the 2-attempt rule. You get 2 tries. That's it.
And let's be super clear here. Stopping after 2 attempts is not a failure. It is the definition of professionalism. It means you're prioritizing the patient's safety and the integrity of the sample over your own pride. Poking a patient over and over again increases their discomfort and risk of injury, and it also degrades the quality of any sample you might get. Knowing when to stop and ask for help is a sign of strength.
Okay, the sample has been collected, but you are not done yet, not even close. Now we enter our final critical stage, phase 3 after the draw, where we have to preserve the sample's integrity.
Now, let's talk sequence. This is the standardized order of draw. This protocol was designed for one crucial reason, to prevent the additives from one tube from contaminating the next. Every time you switch tubes, the needle can carry microscopic droplets from one stopper to the next. This order is specifically designed to minimize any interference.
So why is this so serious? Well, check out this scenario. If you draw a lavender top EDTA tube, which is full of potassium, before a serum tube, you can cross-contaminate that second sample. This can make it look like the patient has dangerously high potassium levels. Now, if that patient is being prepped for surgery, a doctor seeing that result might cancel the procedure or give the wrong treatment, which could have fatal results. The order of draw isn't just a guideline, it's a life-saving protocol.
Another major issue after the draw is hemolysis. This is just the medical term for the destruction of red blood cells. When they burst, they release all their insides into the sample, which contaminates it and dramatically skews test results, especially for things like potassium or liver enzymes. A hemolyzed sample is often totally unusable, meaning you have to go back for a painful and time-consuming redraw.
The good news is, hemolysis is highly preventable. We already talked about using the right size needle. Also, make sure that alcohol is completely dry before you make the stick. Don't milk or excessively squeeze a finger during a capillary puncture. And, maybe most importantly, handle those tubes correctly right after the draw.
This visual makes the difference crystal clear. You should never, ever shake a blood tube. The goal is just to mix the additive, not create a foam party. The correct technique is a gentle inversion, just turning the tube upside down and back again, between 5 and 10 times, immediately after you draw it.
Okay, so we've done everything perfectly so far. The patient was ID'd, the technique was flawless, the tubes are in the right order. But all of that can be undone by a mistake in the final, critical step.
This is absolutely non-negotiable. Samples must be labeled immediately after collection before you leave the patient. Not at the nurse's station, not down the hall. At the patient's side. This is your final check to make sure the tube in your hand belongs to the person right in front of you. It closes the loop on patient identification and prevents a catastrophic mix-up.
So, we've covered all these phases, from preparation all the way to final labeling. What does it all add up to? What's the true mark of a professional phlebotomist?
It really comes down to these 3 words: precision in every single step of your technique, an unwavering commitment to the safety of your patient, and the professional integrity to follow the protocol every single time without compromise.
And I'll leave you with this final thought. Phlebotomy isn't just about collecting a sample. It's the very first data point in a patient's diagnostic journey. The accuracy of everything that follows, the diagnosis, the treatment, the outcome, it all starts right here with you.
Thank you for watching. Like, share, and subscribe.